All right. We are going to go ahead and get started because we have this conversation scheduled for just about 60 minutes. We do have the opportunity to go over if we need to, but we just want to go ahead and respect everyone's time because we have got a lot to talk about today. Welcome, everybody. My name is Barb Cardell. I am PWN USA, the Positive Women Network of the United States of America, Leadership Development and Training Director, and I am honored to be here today with all of you amazing, amazing advocates who are coming together to talk about the Florida ADAP crisis and to have a conversation about it. Just a few logistics before we get started. This meeting is being recorded, so if you would like to turn off your video or rename yourself, please feel free to do that. We are here just so that we can have a conversation. But we do know that a number of advocates want to go ahead and listen to our recording who aren't able to join us because many of them are actually in Tallahassee at the state capitol. And so we are really grateful for everyone with the to be here with us today or who is listening afterwards. So we're in meeting mode. We want to make sure that we get as clear a recording as possible so people can listen. So keep yourself on mute, star 6 to mute yourself, or just the mute button. We're going to have time for questions at the end, but feel free to put them in the chat if you're like I am and you have a great question and you're worried you're going to forget it. You can go ahead and put it in the chat and we'll come back and make sure that we answer as many of them as we can. Or if we do not know the answers, we will go ahead and send the response out to everyone who has registered. We will stop at several points though to answer any questions you might have. We are really fortunate today to have two amazing Florida advocates who are going to help present. We have Kamaria Laffery from the Sero Project, and we have Alicia Trammell McIntyre, who is with the Positive Peoples Network. I've introduced myself. I'm Barb Cardell, and we have Helena Halle, who is with PWN as our legal fellow. I'm going to ask each of them to introduce themselves when they are ready to actually to share some of their thoughts. We're not going to go ahead and do introductions now because that'll slow us down and we've got things to do. Our agenda today, just so you have a sense, is that we're going to do this welcome, then we're going to talk about ADAP and the Florida ADAP circumstance, just to level set, to make sure we all have a shared understanding of what's going on. Then we're going to hear from Florida advocates, on the ground folks. We'll have time for questions and thoughts. And then we have a couple of suggestions about what you can do, both as Florida advocates and as advocates and allies and people living with HIV who aren't in Florida, but are concerned about the Florida ADAP crisis, as well as what it might foreshadow with ADAP programs in our own states. As I mentioned, I am with the Positive Women's Network. We are the only national organization that is led by and for women, cis and transgender women, gender diverse and transgender folks who are living with HIV. We've been around since 2008, and we envision a world where all women living with HIV can live long, healthy, dignified lives, free from stigma and discrimination. We have some more information here, but if you'd like to learn about us, please check out our website, which is www.pwn-usa.org, and you can learn more about us. Kamaria, do you want to talk a little bit about the Sero Project?
Sure. Thank you, Barb. I'm Kamaria Laffery, co-executive director at the Sero Project. I use she, her pronouns. I'm a woman living with HIV, and I'm from Florida, as I put in the chat. Sero Project is an organization led by people living with HIV that centers people living with HIV leadership to end HIV criminalization, mass incarceration, racial and social injustice. And we support this by centering networks of people living with HIV. We do all this work to improve policy outcomes, advance human rights, and promote healing justice. I won't read our whole spiel to you all, but this is the work that we're grounded in and something that I'll talk a little bit more about later. Back to you, Barb.
Thanks, Kamaria. So we're going to go ahead because we know that for some folks, when we're talking about ADAP or the AIDS Drug Assistance Program, people might not know exactly what we're talking about or might have an idea about how they have needed to utilize it in the past, but perhaps aren't aware of the history and what is being threatened in Florida. So we're just going to do a little bit of an overview so that we all have a common understanding. And then we're going to go ahead and get to the Florida advocates. And so I'm going to go ahead and invite Helena to walk us through the ADAP crisis and what ADAP is about.
Thank you so much, Barb. Hi, everyone. My name is Helena. I use she, her pronouns, and I am a legal fellow here at PWN. I'm based in Minnesota. And so we're hoping to give you just a little bit of a policy background on what's happening and why we're all gathered here today. So as you know, the AIDS Drug Assistance Program supports people who are low income or who have limited or no prescription coverage access HIV medication. And so usually it's separate funding through the Ryan White Care Act, and it serves about 1/3 of all people living with HIV. So it's a federally funded program, but it's administered through the states. So that means the states have the ability to determine eligibility, cost sharing, cost containment, residency requirements, and things of that sort. Next slide. Thank you. So, Florida Department of Health announced radical changes set to go into effect March 1st, 2026. So that gives us 2 months. The first thing that they changed is that for uninsured clients, they're reducing the poverty level, the federal poverty level eligibility from 400% to 130%. And if numbers is a little bit easier, because I'm a numbers person, for one person household, that would be those making 62K. Now it's only for folks who are making 20K a year. For insured clients, they will continue to pay copays for people between 0 to 400% federal poverty level, but they are eliminating premium assistance. That doesn't mean they're getting rid of insurance. It's just folks are now responsible to pay their own full premium themselves, or they have to determine to discontinue coverage. They're also eliminating single tablet regimens and only providing generics. And they're also eliminating the rebate model, which actually allows for lowers medication pricing for eligible patients. Next slide. So why is Florida doing this? Florida's Department of Health is claiming that they're in a budget constraint, and this is cost containment measures that they must take because there's a $120 million budget shortfall that requires these changes. As far as I know, as of yesterday, there's been no documented proof from the Florida Department of Health regarding the budget shortfall, where it's coming from, and why these specific measures are necessary at this time, and why in 2 months. Next slide. So at PWN, of course, we center women, cis and trans, gender diverse, and trans people living with HIV, and this will have such detrimental impacts on our community. This is life or death programming. There's about 130,000 people living with HIV in Florida. 30,000 of those people are on ADAP in Florida, but it's estimated that 16,000, over half, are going to lose coverage because of these changes. And at PWN, we know this is a gender justice issue. This will have disproportionate impact on women, dismantling crucial support structures which make viral suppression harder to achieve for women living with HIV. And we also know that folks, especially women, are facing additional policy hurdles because of the Trump administration, which is going to compound and interact with these changes. For example, the work requirements for Medicaid that are starting. And we also know this is a racial justice issue. Women of color will disproportionately be impacted. 42% of ADAP users nationally are people of color. And we know that a disproportionate share of women of color are living with HIV. And we want to note that trans women, especially Black trans women, also face multiple barriers in accessing to care. So they will be especially harmed. And we know that continuity is safety. Medication disruption has widely harmful effects. It increases the risk of missed visits, missed labs, missed refills, and it increases the chance that folks who lose undetectable status are likely to be criminalized under HIV criminalization laws. Also, 65% of ADAP clients in Florida are actually on a single tablet medication. And the Florida Department of Health is claiming that this is too costly, but they have not shown data that says that this change needs to happen and that single regimen medication actually is more costly. And finally, Florida is unfortunately the blueprint. We've been in a lot of rapid response meetings. Texas, Louisiana, and Indiana are watching. And there's a warning that any state that says we're in a budget crisis might soon implement cost containment measures for their ADAP programming. Next slide. And there's also impacts just beyond care, and I'll pass it to Kamaria to follow up on that.
Thank you, Helena. And as you already spoke on and highlighted around the threat of criminalization, the work that Sero Project does, and me as a woman living with HIV, this is a deep concern I have. Our quality of life is being threatened, first and foremost. The loss of care becomes a legal vulnerability if this measure goes into effect on March 1st as written. The coverage shift and the lack of transparency from our Department of Health without opportunity for feedback from community continues to feed and strengthen this really harmful narrative that people living with HIV are a problem to be controlled instead of people who deserve care and dignity and access to quality of life and the things that we need for our quality of life. This ultimately can create treatment gaps that get used against people living with HIV, and yet another way to dismantle public health prevention and care efforts. These cuts with ADAP strengthen the stigma and surveillance, and they don't create safety. The threat of criminalization increases stemming from the way clients are notified with the letters that went out, being sent to people's homes that hold details about their status and their care, which ultimately is like forcing disclosure in spaces that may not be safe for some people living with HIV. And this can lead to situations around intimate partner violence, coercion to be reliant on unsafe partners or family members for access to, like, can you help me? Can you spot me on my premium? Like, can you help me out? And that could like just lead to really harmful dynamics in relationships, and threats to potential violations of parole or probation for potentially non-related HIV charges for folks that have been notified through these letters coming to their homes, and other issues before an arrest can even be considered. So that's what I call the threat of criminalization. It's not law enforcement showing up and telling you you're under arrest. It's the things that can happen that can lead to that. Also, these decisions deepen racial and economic justice, as we already named. Florida ranks number 3 in the nation for HIV transmissions and has some of the most punitive HIV criminalization laws that target mostly marginalized folks. This ADAP crisis has not revealed cracks in the system, in my opinion, but will widen the chasms that already existed and were barely being held together. And we need these life-saving measures to keep people on their treatment. Cuts like this will tend to push people out of stable care and into vulnerability, a vulnerability that criminalization laws will exploit and disproportionately continue to harm our community. Lastly, I'll just say advocates must demand transparency and accountability, and I'll turn it back over to Barb and other advocates to be able to talk about how we're doing that.
Muted and unmuted myself. There you go. So I think before we go ahead and get to the Florida advocates and advocacy, I just wanted to stop there because that was a lot of information, and to see if anyone has any questions. We did have a question in the chat that was asking about if a health insurance plan was covered under the ADAP program and is not going to be covered after March 1st, if that plan will be canceled or if the client will be sent a bill. And thank you, Riley, for sharing your thoughts that as a former case manager, you would guess that the insurance would continue through the last day of the last fully paid month. And so if the client or the ADAP program doesn't cover it by the deadline, that then the insurer would cancel the policy. And so a
Barb,
lot of, yeah.
I'm sorry, I'm driving, so I can't raise my hand. So in our meeting with the Surgeon General, it came up, I believe, that individuals have 60 days, or it was, David, do you remember where it came up that you could have your policy reinstated within 30 or 60 days after the March 1st date? So there may be some ability to still have some coverage, but there's also people who right now are being denied by ADAP, Biktarvy already. We're hearing reports around the state. So there are ways that the coverage can be reinstated through grace period, and you're supposed to still be able to get your benefit during that time, but you'll still be responsible for the premium at that time as well.
And as we know from a number of other federal laws that have been passed, that people's premiums have gone up and assistance around the earned tax premium tax credits has also become problematic. So when we talk about people paying for their own insurance, that is going to be a challenge for sure and something to talk about. But thank you. And that's Michael Emmanuel Rayner, who is going to be helping us talk about the advocacy that's going on in Florida. So thanks for coming off of mute, Michael, and please drive safely. You know, I always am concerned when people are participating and they are on the phone, but I would imagine you have been on a lot of conversations lately on the phone, so you've got it figured out.
Yeah, and I have the dog driving, so don't worry.
Okay. And
no, thank you. I think, oh, did you want me to start, or I'm sorry?
No. I just was checking to see if there were any other questions here.
Got it.
Able to change. Yeah. And it looks like Kristen has shared that they had clients who called the marketplace as early as yesterday and were able to change their higher ADAP covered plans to a more affordable plan, which is really helpful to know because open enrollment was closed on January 15th. So they might be being willing to give people a little bit of leeway. David, I'm going to go to you, and then it looks like we've answered all of the questions that have been brought up.
Thanks, Barb. Yeah, Kristen, that's just really valuable information because we haven't heard much positive this week. So thank you for sharing that. And then I want to just punt back to Michael Rayner. Sorry, Michael. I see you went back on mute, but didn't you take issue when we met with the Surgeon General yesterday with letters that actually had suggested they had terminated patients' insurance? And I'm sorry if I've misunderstood that. If I just wanted you to address that, if I'm right.
Yeah. So we don't have clarity, and all you did is make me put my donut down. So the issue here, hey, you're driving 6 hours, 7 hours. So the letters, the way they're written, the Florida Department of Health in the letters state that your last day of insurance coverage will be on such and such date. For some letters, I think it said February 28th, and there's some I think that say March 28th. So I don't know why the difference, whether it's a difference between an ACA policy or whether it's an employer-sponsored plan, it's unclear. And the speaker before you, Kamaria, I don't remember her name, the fellowship.
Helena.
Thank you. So some of the information she provided, I have some concerns because that is not written guidance from the Department of Health yet, which we stressed in our meeting with the Surgeon General yesterday, that people are still trying to figure out the information because we keep getting conflicting information. They are going to be coming out, I believe, David, am I correct? They alluded that they're coming out with more guidance next week.
You're
All right.
correct, Michael.
Okay. And then, so
Yeah.
going
Thank
back
you.
to the others, yeah. So they're kind of telling people that they're terminating your insurance policy, which they really are. I don't think they're really doing that. I think what they're doing is just not making the payment. And they failed to tell people that you have the opportunity that while our funds have been exhausted and we can no longer pay for this, I berated them and said, you need to educate people and let them know that they have the opportunity to keep their own policy in force if they should be able to identify another funding stream. And in that same letter, what doesn't make sense is they're directing people to Medicare and Medicaid. This was a big part that David made in the meeting. And if you're not already in Medicaid and Medicare, it's a waste of time to send somebody to try to apply for Medicaid or Medicare. So it's absolutely preposterous what they're doing in the guide that they put out. So we do, I'm anticipating better guidance because we have humiliated them in numerous meetings and to legislators and in the appropriations committee publicly.
All right. Thank you for that. And thank you for highlighting that some of the information, well, all of the information is not particularly clear. And that indeed through advocacy, amazing advocacy in the state of Florida, we have highlighted, you all have highlighted where they have fallen short. And so hopefully there will be clearer guidance coming out. Speaking of which, I want to go ahead and get to hearing from Alicia and from Michael about the advocacy that has happened in Florida. Because that is what we know. We know that our community showed up, showed out, and as Michael said, really, held their feet to the fire and even humiliated them in ways to let them know that this is not acceptable, that the community of people living with HIV, our allies, and the people who care for us are not accepting this. So we have a summary of just some of the advocacy that we're aware of that we wanted to lift up. There has been testifying at the Florida legislature, and if you have not seen Michael and his testimony, I would recommend it. It is a masterclass in how to actually testify and hold people accountable. We have had rallies and phone banks and community conversations, especially lifting up the Positively You phone banking that they did on the 16th. In partnership with the Save HIV programs. There was a fantastic Empower HIV town hall, Lives Are Not Line Items, yesterday. That's on the Facebook page with the Empower HIV Health. And they had a great conversation, really lifting up the impact and the damage that this crisis has done on people living with HIV in Florida. There was a remarkable press conference yesterday, and I'll put the link to an article that came out of that press conference with Representative Frankel and Wasserman Schultz. Michael was part of that testifying or presenting on that press conference, bringing the voices of people living with HIV to this, which I thought was so powerful. And then we have a future advocacy and ongoing efforts. And so I'm going to go ahead. And Alicia, do you mind if I pass to you first to talk about your engagement and your advocacy? First off, please introduce yourself and then tell us about what advocacy you have been engaged in around this ADAP crisis in Florida.
Absolutely. Thank you for that, Bob. Good afternoon, everyone. Good afternoon. When I tell you the last 3 days have been just so rush, but it was for a good reason. So I'm Alicia Trammell McIntyre, self-proclaimed Mrs. HIV, along with my husband, who's Mr. HIV. I am the CEO and founder of Positive People Network, Inc. It's a social organization here in Miami, Florida, for all people living with HIV to have a better quality of life and reducing stigma and just being present and accounting for. And we were fortunate that PWN, yes, 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 was able to sponsor me and 3 ladies from our organization to go to Tallahassee. As a matter of fact, we left Monday night after we were in the Martin Luther King Day parade, and we went to Tallahassee. So, order of events. Tuesday morning, we met up at the IMAX Theater down the street from the old Capitol to build signs and build momentum and get pumped up. And then we all walked to the Capitol. And when I say it, just in the room, it was uncertainty, but it was support and love. And everyone who was there was just so engaging and so proud to be there and proud to be in the spot to support our state. And I was just happy to be in the room because, listen, I've been living with HIV for 30 years, and I can say that y'all see this shirt, for only those of you who know what this is can go back to 2018, y'all. Started with PWN at 2018. Best times ever. Matter of fact, that's the last time I had one in 2018. But back to the rally. I get thrown off a little bit. So it was me and a whole bunch of different organizations. Equality Florida, AHF was there, and a whole host. If I don't call your name out, charge it to my head and not to my heart, because we showed up and had representation, and it was phenomenal. And when we went, I hadn't planned on speaking, but one thing I do know, that favor is a real place. And when God elevates you and puts you in the spaces for his people, beautiful things happen. I was allowed to do a speech, and I'm going to tell you, before I left, I said, what if they let me speak? I had something ready and in hand, and baby, when I went up there, it was phenomenal. And it came from one of us. It was a lot of people that went, a lot of allies, but
Yes,
it was
it
from
was.
someone. Oh, yeah. And it was from someone who actually takes Victoria, who actually is receiving ADAP, who actually had to, like the gentleman said, change my provider. I had Florida Blue, and they were just the worst. So actually on the 15th of this month, my caseworker told me to call them, because here's the thing what Florida Blue did. They were passively keeping people in Florida Blue. Whether you wanted it or not, if you was ever in there, you could stand there. So they passively kept me in Florida Blue. And I had to call and change and say I wanted a different provider and do all of that 3 hour on the phone thing, which y'all know that it's a lot, but was able to do that and change my change to, I don't know the name of the organization, but change from Florida Blue. And I don't know what my medication is going to look like after March, because I take Victoria. And the fact that they're changing the formularies is another thing for me, because this works for me. One pill, I'm good. At bedtime, I'm good. Go on about my business. But now I've been on this since 2018. 2018 is the number for today, baby. Y'all better play that. Since I had my gastric sleeve. I had a gastric sleeve, and that's when I started taking Victoria, and it's been working for me, been undetectable ever since. And I'm just one person who went to Tallahassee, who is a woman living with HIV for 30 plus years, who is on ADAP, and who is taking a medication that they're trying to remove. And I didn't go alone, y'all. I took Gina Barr Grant, my vice president. I took 2 members of our Stop the Silence Ambassador Speakers Bureau, Deborah Davis and Cynthia Mitchell. And we're all on ADAP. And the uncertainty is real. So at least we had representation from the community of people who would be impacted and affected by the changes. Then
Alicia.
Yeah, baby. Yeah.
Yeah,
I'm
thank
good.
you
Yes,
so much
yes, yes.
for all of that.
Yes.
Absolutely. I think that is so powerful. And the fact that you all were able to go and to lift up the stories of people who are going to be directly impacted by these changes is so powerful. I'm going to go ahead and I'm going to pass to Michael now. And then we'll go ahead and get into the conversation. And I'm sure people will have lots of questions for you. But first off, I just want to thank you so much for traveling to Tallahassee and lifting up the voices of people living with HIV.
Hi again, everybody. Yeah, it was great to see her up there along with others. You know, it I'm just going to speak as a gay white man for a moment that, and I have continued to say this to David and others, that when we've been going into some of these spaces, um, we're gay white men. And when we walked through that door, we left our identity behind and we spoke out for all communities. We hit them on linguistic barriers, on racial barriers, on everything. We did not leave our community behind that door. And regretfully, getting these meetings and getting people there and the time we're actually given to even get ourselves to a meeting with an hour's notice to meet with the Surgeon General has been impossible. And I'm glad I'm able to find people in Tallahassee at the moment that were able to back with me when I'm in certain spaces. A lot of the advocacy I'm doing is, well, I've been engaged with getting Democrats on board, which is a real easy thing. You just throw a few breadcrumbs and they're all there right away. A lot of it's been messaging with Republican lawmakers that I've been meeting with. And I have to tell you, I am blown away with the amount of humanity that there is on this issue, the amount of commitment to make sure this is a bipartisan issue, that are really leaning in, engaged, and wanting to solve this issue. The Senate president today spoke. He didn't give any commitment other than it is being looked at, it is being discussed, and they are looking to try to come up with a solution. But they're still studying the problem to figure out what actually is wrong and what actually needs to get fixed. I'll send that video to Kamaria so she can share, or actually I'll put it on YouTube to share so that there's a link to it. And one of the things that also is needing to happen at this time, and David, I'll weigh in for you, AIDS Healthcare Foundation and other organizations are sponsoring a legal action to come forward for an injunction to stop this. Now, what's needed to ensure, what you'll recall on the federal level, when the NAACP files lawsuits, they've been thrown out at the federal level for lack of standing because they're not the actual injured party. So we are needing names of individuals who are of the who access ADAP in the 4 different ways that ADAP serves clients, to ensure that we have at least maybe 2 people from each category, to give their name. And it's also to ensure for some diversity, as well as the diversity in how people are accessing the program, so that those lawsuits can go forward and hopefully we can get an injunction. We, at this time, we've demanded that the Surgeon General call for a public health emergency.
I'm about to probably just go on.
Take that.
Yeah.
Would you?
And
No, just
Love,
put it.
you don't have your mute on. Elisa, your mute's not on. Now it is. So one of the things we're demanding that the Surgeon General work with the governor to call for a public health emergency. We haven't had monies needing to be spent that are in the reserves fund that could be used, that were otherwise used for a hurricane or disaster. And that could patch the hole in the meantime, while the legislature works on a budgetary fix, which will be addressed at some time mid-March, which is after when premiums need to be paid. We're already hearing people skipping dosing of medications. It is one of the messages that's been very effective when I meet with Republican members.
Mm-hmm.
Oddly enough, in a room yesterday, 2 doctors, the Surgeon General and Deputy Secretary Dr. Shepke, I think less when I gave that example that people are skipping 1 and 2 days to take medications to stretch out and stockpile. We know what that does in terms of inviting medication resistance. So the understanding was just appalling, or the concern at that time. I think, David, I've talked so much and I've been on a media interview for the last hour, and I'm going to be getting a few more media calls coming in. So I don't know if Barb, if you want David, or Dr. Ahrens. Dr. Ahrens really hit on a lot of the medical components in a lot of these meetings, and really challenged Dr. Shepke, and actually became a target for the Surgeon General office. And so if the two of them can weigh in,
we're going to go
I'm
ahead.
so tired.
Yeah, Michael, I have been watching your videos over the week as you've gotten more and more exhausted. So please take care of your precious, precious self. We want to make sure that you are here to advocate with us for years and years to come. And I know that you have been doing so much work on it. I'm going to actually go ahead and pass to Maria, who has got their hand raised,
Okay.
and then we'll go ahead and we will open it up for questions and if David and other folks want to go ahead and share at that point in time, we'll invite them to come on in. But Maria, hey, sweetie pie, it's so good to see you.
Thank you. Hello, everyone. I'm currently in my country, Colombia, but unfortunately, I'm not even able to enjoy my mother and my family because of I just can't. It's overwhelming what we're all going through, and it's here as well and all over the world. And what I wanted to say is a few thoughts that come quickly to my mind. I'm not going to take a lot of your time, but when I found out I had HIV, I'm a 37-year long-term survivor, but when I found out I had HIV, it was in 91. And we had to come back here to my country with my mom and my brother. So I was without access to treatment for 10 years. And I came back to the US dying and with cancer. And ADAP saved my life. So this is very I feel very triggered. And so I remember being able to be alive and being undetectable at 4 weeks, and I'm still here. And in 2012, there was a waiting list in Florida. I don't know if you all remember this. And I went to all the town halls, and the list was like with 1,000, I think it was like 1,200 from my recollection. There's even like footage that I was showing my mom today, and I just can't believe that this is happening again, even on a bigger scale. And that was solved. And this was like a lot of people were like, no, they were probably undocumented immigrants. And I said, no, these were American citizens that paid their taxes. And I remember getting which is irrelevant, but I do have to say how ironic everything is. My first award in 2012 for the social media campaign for ADAP Advocacy Association. And now I'm in their board of directors. And but honestly, this is what my thoughts are. I was raised in Miami. I currently live in Fort Lauderdale, Broward County, and we all know that that's like number one and number two. I don't know if it's changed. Most of the people, as we all know, is Black and brown people that are affected. I believe that it's a way like Hitler did to just wipe us out. I mean, I do really. There is no other, and being very evil to take away life-saving medications from human beings. I don't understand how they could be so evil. So right now, I know it's not legal, but there's a lot of people that are reaching out to me for their medication, and I'm contacting them with people that are donating. And one of the letters there is from one of the people. Today I spoke to the Washington Post, so that gives me a little bit of encouragement. And also you, Mr. Rainier, I believe is how you pronounce your name. I'm sorry if I'm pronouncing it wrong. I'm a little nervous. Thank you. I'm watching all your videos and sharing all over the place. Thank you for all that you're doing, Alicia, and everyone here in PWN. And by media covering all of this, I believe that it is spreading out there. And I had some MAGA people telling me today, nah, I haven't heard that. That's not happening. How the hell you don't have a way to research and to see that it is happening? So until it affects them or someone, but maybe they don't even care if it's their family that's affected. So I think that we just have to continue fighting and putting pressure. But I believe that I'm trying not to be pessimistic. It's getting worse. And I just want to say to you all, thank you for all that you do, and that anything that you all need me for, I'm here, no matter what where I'm at until my last breath. Thank you.
Yeah, Maria, thank you. It's a reminder that for those of us who are living with HIV, and especially those who've been living with HIV for a long time, but really any of us who are living with HIV, that these programs have saved our lives over many years. And when they are being challenged and dismantled or defunded, that it feels very, very personal, and it is incredibly triggering, and it affects us. Which, in the midst of everything else that is going on with this regime, having one more thing that is gutting us, really, making us feel terrified is so hard. And that's one of the things, actually, when we're talking about what the demands are that the advocates are lifting up in Florida. One of them is that they actually want the state to acknowledge the impacts that this programmatic instability has caused to vulnerable communities. People don't understand. And yeah, Kamari, thank you for that reminder. We save us. That is the lesson we have from the early days of HIV, is that we've always come together to save ourselves. I just want to lift up real quick what we're hearing from advocates, what we've been able to gather. And it is important to note that indeed this ADAP budgeting process was not transparent at all. It did not include community feedback. There was no meaningful involvement of people living with HIV or providers. So this was a decision that was just made in probably some back room somewhere or some hallway somewhere that did not include the impact on the 130,000 people who are living with HIV in Florida. We want to make sure that the demand is that there's a continuity of care directive, so that people whose insurance are changing or their medications are changing are actually able to be provided for while these changes are going through, as we discussed about the health insurance premiums. Big piece is that we want to, and this was amazing from the press conference yesterday with Representative Frankel and Wasserman Schultz, is that they're actually calling on Health and Human Services to hold a oversight committee hearing and to actually determine where the funding has gone and why this funding has been so problematic. This is a federal level intervention, which is really powerful. And then also that any communication that goes to ADAP program recipients needs to be in multiple languages, needs to be easier to read, needs to have clear statements about what people need to do, and also needs to include somebody to contact. And so based on the advocacy that people have been doing in Florida, we are able to pull this together and to share that this is absolutely what we both nationally and as advocates in Florida are supporting. And so we have time now to just kind of get some questions and some answers and some thoughts from people. We might not have all of the answers here today, but certainly we can come together and we can share how this is impacting us, how people are feeling. And I'm saying us because I feel like today I'm an honorary Floridian, because I am pissed off. And when any of my siblings living with HIV are under attack, I am absolutely there and engaged. So hopefully I'm okay. You're all are okay giving me the honorary Floridian status today, because it feels like this is a fight for all of us. As Helena mentioned, this is telegraphing what is possible to other states. And so it feels like Florida is just the trial. So I'm going to go ahead and open it up now. If anybody wants to raise their hand, I know some of you are driving or maybe don't know where the raise hand feature is. Just go ahead and come off of mute. Maria, yeah, what is the reason these mother fluffers are giving for gutting the ADAP program? And so I'll go ahead and see if one of the other Florida advocates wants to go ahead. David, go ahead.
Maria, thank you for your very emotional and powerful comments. I actually used to run this program. It was over 20 years ago, but I had 12 years that I was over had responsibility with an incredible team of people that cared about people living with HIV back in those days. Unfortunately, Michael Rayner, Paul Aarons, and I witnessed some things that I want to come on a call like this and be uplifting, but that's not who I am. I'm about transparency and honesty. That's not who the Florida Department of Health is anymore. In fact, we left there yesterday. I think it's the first time, and I'll tap back into that energy again, in tears, because I've never seen the so-called leaders, including Surgeon General Ladapo, sit in front of us just a matter of a few feet and say the things they said, which were disingenuous, and they showed no empathy other than crunching numbers and having to do what they had to do to serve. Even though it was going to be serving far fewer people, they had to do this. And to answer your question, Maria, they say they have a $120 million deficit, but when we tried to drill down and get the answers to questions that I don't want to get into the weeds and bore you all with, there was nothing they came forward with that made any sense. And they were talking to people that know this program really well, that have been affiliated with this program for decades, for at least 30 plus years. So I don't have good news on that front, but since you asked the question, I wanted to try to address that. And at the same time, thank you again for bringing your message and your story forward. It breaks my heart that this state and this country has gotten behind this program for so long, and then we have to be the leader that does something so horrendous and so outrageous. And I want to give a nod because I don't think Alicia could remember my name, but I had lots of loving hugs from Alicia and Gina yesterday that were out there in front of the Florida Department of Health headquarters, yelling loudly. And that's what we needed to do, and we're going to keep doing it. So I just wanted to throw my 2 cents worth out there too. Thank you.
Yeah, thank you, David, for taking that. I was going to say I could share what I've observed, but it wouldn't be fit for work or probably for this Zoom call. So thank you for taking it, and also thank you for your time and your advocacy, because I know you were there and have been so engaged as well. We have another question from Samsung. I'm going to go ahead and pass to you next.
You're muted if you're trying to speak. We can't hear you. We can see you, though. We still can't hear you.
Yeah, no.
Wait, you almost did it. Good.
Yeah.
Try again.
There you go.
There you go.
Hi, Elisa. Hi, Gina. Can you guys hear me?
We can. Did you have a question or a comment you wanted to share?
My question is I just wanted to share this first. First, I want to say how proud I am of Alicia and Gina and them and Cynthia for going. I'm sorry work wouldn't let me get out of being able to go. With that being said, I am a person living with HIV for the past 32 years. I gave birth in my way of finding out that I was positive. And ADAP has been a tremendous help to me in my health. I'm trying to find out what is it that we can do, what I can do, work with the population daily. How can I get them involved? Because we're great in numbers. How can I get them involved? Like speaking to their doctors or signing a petition, or what is it that I can get the 8 ladies that I work with daily involved in this?
Barb, if I could answer that.
Yeah.
So one of the most effective things I was told by one of the Republican senator's office, they said, if you can't get to one of the offices, whether it's the district office or the Tallahassee office, for your state senator and state representative to voice your concern, was to actually pick up the phone. And because we're in session, call the Tallahassee number and and expressed the need for this program to be protected. They urged against doing an email because emails get easily deleted, and the phone calls will just inundate the office. And that is what was said to me. Now, it won't hurt doing both. Equality Florida is going to be releasing an email action alert for people to participate in, which it's still worth doing because it records how many people are reaching out. But phone calls and personal visits to offices are the most impactful thing to keep the pressure on the elected officials.
Thank you so much.
Michael. That's a
Thank you.
Great point. And we will share, there was a question, and just in case people can't see the chat, I want to just go ahead and share, and then I'll pass to you, Paul. We will go ahead and share the slides with everyone, as well as we have next steps and resources, and we'll make sure that everyone who registered for the webinar has access to that, because indeed there are actions that everyone, whether you are an advocate in Florida or if you are someone from across the United States and you want to go ahead and both tell people how frustrated we are about the Florida crisis and also how concerned we are about ADAP as a national program. So we'll go ahead and share that with everyone. And thank you for that great question, because we know that by bringing others along, that is how we amplify this and get attention. Paul, I'm going to pass to you.
Thank you very much, Barb. And thanks everyone for being on this call and having this discussion. So my name is Paul Ahrens. I'm a physician, and I also used to work in the HIV/AIDS program. I was a medical director there for many years. Not recently. I left in 2007. But I wanted to address Samsung's question and Maria's as well. So I'll start by saying that last night there was a conference call that involved the HIV Medical Association, the American Academy of HIV Medicine Florida chapter, and the Association of Nurses in AIDS Care, ANAC. And these were professional people who provide care, particularly to people with HIV. And out of that, they're demanding a meeting with the Surgeon General, and they want to talk about the details of switching regimens from a single tablet regimen like Biktarvy to having to take generic drugs, for example. So they're going to generate a letter and to express their point of view and request this meeting. So when you ask about what can you do to move the needle here or to be represented, I think that's possibly an option, whether Sero or PWN can generate some kind of communication, because I agree with what Michael said, that we tried to represent as broad an interest as possible when a small group of us advocates went in to meet with the Surgeon General. There's no substitute for people of an actual demographic and who actually represent these issues to go in and make themselves known. For example, we raised the point that the guidance that's being published by the Department of Health is in English only, and it leaves out the people who speak Spanish, people who speak Haitian Creole. To the extent that those groups can represent themselves in communication, that's highly significant, I think. There are a couple of points in the slides that I think need to be emphasized and need to be emphasized by the people who are directly affected. For example, in one of the slides, it said 42% of ADAP clients are people of color. I think that really needs to be elevated. The disproportionate impact needs to be elevated. In one of Kamaria's slides, there was a statement about the increase in legal vulnerability, and it talked about communications, letters being sent to people's houses, where maybe other occupants of the house are not aware that this individual has HIV, and it leads potentially to domestic violence and recriminations. Those are the sorts of things that, because of time limitations and the limitations of people who have been going in to have these conversations, they don't get expressed. So to whatever extent um, that the organizations involved in this call, the people involved in this call, can make those points in an organized way and communicate them to the people at the Department of Health, I think that would be very valuable. So that was the first thing. And I'll just say, secondly, Maria's question about why are they doing this? I'll risk getting a little bit into the weeds here. They claim that they project a $120 million deficit if they kept running the program at the level that it's run now. They say that the federal allocation of funds under the Ryan White Care Act for ADAP is insufficient. It's been level funded for many years. They say it's not enough. And they say that the rebates, the drug rebates that are generated by because of the insurance payments, and I won't get into all those details, but suffice it to say that those rebates finance about 2/3 of the program, but that they're unreliable. And so they're unable to count on them, and they can't continue funding the insurance part of the program. They say that when they switch people off of Biktarvy, they can save $23 million because they're going to be able to put people on generic drugs. They don't take into account what a traumatic situation that is for someone on a successful regimen that's suppressing their viral load to have to switch to something that they've never been on before, that they don't know if it's going to work, for example. But it is true that there are less expensive medications. They're just not as good medically, and they're not necessarily successful for the person who's going to be forced to take them. So those are some of the explanations, and there's much more to it. But I hope those address some of the concerns that you have, and certainly after Donna speaks, I think it will be great to hear even more of the folks that are on the call here talk about how this is impacting their lives.
Yeah, thank you,
Yeah.
Paul. Maria.
Yeah, thank you, Barb. Thank you, Paul, for always like driving home the nuances of the issues that people need to amplify. Before we go to Donna, I just want to highlight, because I'm also getting messages like direct messages, private ones. I want to highlight something I put in the chat as well. If folks want to help draft a We the Floridians letter from the people living with HIV that are going to be impacted, please, I'm putting my email in the chat. Please contact me. I think my email will also be on the slides. It's like kind of my play on a WTF, like what the We the Floridians instead, just framing it, or we name the problems, but we also name our demands and we also name the impacts. Maria, I would love if you could be a part of that drafting of that letter. So I'll try to pull us all together so we can share a document and talk about it. And then I think this has already been addressed, but I was talking with someone privately. Those of you that are on that are not from Florida, you're asking what to do, and we're dropping links to share. Keep amplifying that this is happening to help us keep putting pressure on it. Sound the alarm in your state that you don't want this to happen, and don't just accept it being dismissive. Oh, we weren't even thinking about that. Like, make sure, like, find it in writing. Like, is this what the policy is? Is this how people are staying safe? Like, hold people to the fire. And don't accept BS as assurances for our quality of life and our safety. With that being said, I want to pass it to Donna because I see your hand up, Donna.
Yeah, first of all, I'm going to try to hold it together while I speak, but I see so many familiar sisters on this call. And I was probably your nurse at one time. And please, we are those of us that are not living with HIV, but are in this work and in this fight, please continue to keep these messages coming. We are not the messengers that you all can be. And I just wanted to share that with you, that me personally, I continue this fight because of all of you. And I wanted you to know that, one day I always said when we have a cure for this disease is when I will retire. And with these types of moves that's happening in Florida, that's looking further and further away. So whatever I can do, I've kind of had to be behind the scenes with working with Michael and David and Dr. Ahrens and many others that kind of need to stay a little bit behind the scenes for issues like contracts and other things. But I'm kind of getting tired of that. So whatever I can do, if you need an ear to lean on, if you want to send messages, whatever can be done, I'm here. And those faces I see and those names that I see are just amazing. And you all have the power that keeps those of us in this fight with you able to do what we do every day. So thank you for everything you're doing.
Thank you so much, Donna. And I know what you're holding as a nurse that's been on the front line. And whether you're behind the scenes or not, everyone has a role to play. So thank you, because you've influenced and saved lives of many people on this call. So you're still a part of it, even if you feel like you're operating in the background. So thank you for those words. Michael, I see your hand up.
Yeah, I'm going to make it real quick. So, kind of like Donna just touched on, where there's a lot of people who can't speak because they're being muzzled by the state due to contracts and other types of conflicts. It's been a lot where I'm trying to make sure everybody's voice is heard in this process and issues are done. What I'm going to ask Kamari, if you don't mind, if there are things that while I'm in Tallahassee and while I'm doing some of these meetings, if I'm the only one up there at the time, running the halls like I've been doing and just getting into meetings without having a scheduled meeting, please, if you can maybe reach out to Kamaria, and Kamaria will reach out to me if there's something that, specifically coming from women. And I'll get with you, Kamaria, because I want to hear the unique aspects other than the ones you've covered on how this impacts women, to ensure that I'm hitting on these talking points when I'm in these meetings as well. Because that's not my experience, obviously. But I do want to make sure that I am well representing our collective community as best I can at all times. And it's a challenge. Some good news. I just got a text message from a previous state surgeon general, Florida, who wants me to give them a call as soon as I'm off this Zoom. So I don't know if that individual's willing to get out very soon. And that would be an amazing addition to this fight right now.
Thank you. Thank you so much, Michael. Happy to help, of course. PWN put together an amazing fact sheet. I shared it on my Facebook page. I can reshare that or tag you on it, Michael, if it helps you also with language. But I know also having like direct personal stories helps add to the information that's in the fact sheet. And also we need humanity. Impact needs to be felt, not just read. So thank you for that, and we'll connect. Or you were breaking up a little bit, but I heard something about you have a text to meet with someone after this. Can you repeat?
Oh, I'm sorry. Yeah, I'm on a section of the turnpike. Can you hear me clearly?
We can now.
Okay. So I'll just say a previous Surgeon General from under a different governor in Florida just reached out to me by text, who I've been trying to get a hold of for 2 weeks. And they just got back to me. Their phone had been stolen. And so I will hopefully encourage that person to speak out. And they were a refreshing change for a while, at least from my standpoint. I don't know about David's, but I'm hoping she'll join the fight. So, and if you could email me that one sheeter, that'll be the easiest way, because I can't. I'm lost in just digital world right now. I can't. For me to look for something, I'm buried with people sending me budgets and info, and it's just every night before I go to bed, I spend an hour just going through emails and text
Mhm.
messages to make sure I've responded to everybody. And I have been inundated while trying to farm things out to people and, tell reporters who else to talk to. So it's been really daunting. I can't tell you. David's yelled at me. Dr. Aarons has yelled at me. Barbara's scolded me. Barb scolded me. It's just, and this one is always scolding me. So, but I just want to say thank you so much for everything that you all are doing and mobilizing. And that's inspiring us that are going there, because some of these meetings are tough.
Yeah.
And I will embarrass David. He actually cried when we came out of the Surgeon General's office, because it was just that outrageous to see public health respond so negatively to us.
Yeah, Michael, thank you so much. Sorry, Kamari, I wanted to just hop in and acknowledge that, we're back to the days where Ronald Reagan didn't say the word AIDS for years. And so we were back to the time and the space, and unfortunately Florida is modeling where they're really modeling that our lives and our dignity doesn't matter. And unfortunately, it is very difficult to be in these meetings. So again, thank you everyone who's been a part of the advocacy and the rallies. Paul, I see your hand raised. I just want to check and see if there's anyone else who has a question or a comment. We've gone a little bit over, but
there was one in the chat. I just want to acknowledge for the sake of the recording, for anybody who can't. There was a question around, are there any ads on this? None that I've seen, but I think that's another mobilization tactic that can be utilized if folks have access to funds that can produce an accurate, relatable ad. I'm not quite sure what can drive that, but we do need attention on how people can notify folks, even if it's just a social media ad that maybe folks can share and duplicate. I don't know who can lead that. It's not something I'm not in a position to volunteer for, but I love the
Kamaria, I think we're in touch with some funding sources who might have capacity for that. So let's talk offline on that.
Okay.
Could I also ask if you wouldn't mind, if you wouldn't mind also helping collect the names for potential sign-ons for the lawsuit for affected clients? Yeah, because I want to get that wrapped up and to the organization that's spearheading that ASAP.
Absolutely, and if it will help,
because this is what I'm sitting in.
Yeah, we can talk offline. Barb, I'm going to pass back to you.
Paul, do you have something that you wanted to add?
Yes, I wanted to add
before we get into the next steps.
Yes, I wanted to add one sentence to the explanation about why the department says they can't afford to keep the program going. We mentioned the insurance component of the program. What they're saying is that the increase in premiums, as well as the lack of the premium subsidies that the Congress is wrestling with now, are also major factors, up to $90 million of excessive costs that they can't handle. So I just wanted to put that on the record. And I wanted to say one other thing, which I'll pose as sort of a question. The other point in the slide that I was referring to about the impact on women of color also mentions that there's a disproportionate, an even greater disproportionate impact on transgender women of color. And I'll add to that the impact on people who do not have documentation, who are here undocumented. And I'll say that we, at least the folks that are working and advocating on this, understand that. We're not ignoring those situations. We're sensitive to it. It's a strategic decision, I think, that we all have to grapple with, whether to raise those issues, because they're so discriminated against by the people that are running the government and running the department that it could, I suppose, backfire. But I just wanted everyone to know we recognize this disproportionate impact, and we really, it grieves us greatly, and we'd like to be able to do something about it.
Thanks. Thank you, Paul. Appreciate that. So just want to quickly go over the next steps because we have amazing advocates from across the United States. Maria, do you mind if I go over the next steps and then check in with you? Okay, gotcha. So next steps, as mentioned, if you're in Florida, call your representative, call your state representative, call your senator, tell them you are concerned, beyond concerned, tell them that you're pissed off that these cuts are being discussed in Florida and that you demand that they represent you as a person living with HIV or even someone who is an ally and loves someone who's living with HIV. We have the lookup information here. And again, those will be in the resources that we'll share with everyone. If you are in another state, go ahead and call your federal representatives because they can go ahead and partner with Representative Frankel and Wasserman Schultz in demanding that there be an investigation into where these funds went and why the ADAP program in Florida is in such a shortfall situation. We think it's egregious and that there's problems that haven't been lifted up and are not transparently being discussed. So you can go ahead and demand that. You can also talk to them about why ADAP is so important in your life as a person living with HIV. Extra points if you can do it without crying. And I'm saying that in all seriousness because I talked to my representative today and I talked about the early days of when I was living with HIV and how ADAP saved my life. And I for sure was crying and I refused to be embarrassed about it because we know that ADAP has saved our lives. And if these programs are cut, that lives will be lost. And that is not acceptable in 2026. It's just not okay. So call your representative and tell them how important the ADAP program is because it's a federally funded program. So we want to make sure that it continues to be there. Finally, if you are in Texas, Indiana, or Louisiana, as we said, Florida is just the starting point. Seems likely that this kind of cuts and restrictions to these cuts and restrictions to the ADAP programs likely will come to to Texas, Indiana, or Louisiana next. We put the contact information, call your state health department and demand to know that they are going to protect the AIDS drug assistance program in your state. Super important for all of that. And those are the next steps that we're going to recommend. And we'll have all of these links in our resources that we'll share with you all. But this is a way where we can go ahead and come together as an advocacy community. Maria, did you want to say one last thing before we ended?
Yes. I wanted to ask the doctor again. I'm sorry because I'm getting 1,000 million questions and I'm in Colombia. But isn't it, to me, it's so stupid and idiotic to do this because what they're saying is that they don't have the funds, which I believe is bullshit, and excuse my language. If people start having access to their treatment, they're going to be detectable. They're possibly going to be transmitting the virus, and it's going to overwhelm the health system, the emergency rooms, and finally, it's going to cost more money. So that to me is not an excuse, and I wish I was there to tell them that. So if anybody wants to ever tag me along and take me anywhere, I'm here because that doesn't make no sense to me. It's disgusting and it's inhumane and it's not what the United States stands for, just like with this administration. But I'm just going to leave it at that because honestly, I feel like I'm going to have a heart attack and I need to really meditate after this because I cannot continue like this.
Yeah. Yeah, thanks for raising that, Maria. Paul, did you want to respond to that?
Well, my inclination is to say amen, but it is true. This is both an individual catastrophe and a public health disaster because of exactly that. Here we are. People have been talking about we need to end the HIV epidemic, and here is Florida that is designing something to go in the absolute opposite direction. Thank you for raising that.
Yeah. Yeah, thank you. Thank you so much. So we are at the end of our scheduling, and I just want to remind everyone, especially as people living with HIV, but also for our allies, that this is really hard to talk about. Maria, thank you for sharing how it's impacting you, because I know it's impacting so many of us in the same way, and you just put beautifully to words how heavy it sits on our heart. So I am so grateful to Maria and Alicia and Michael and everyone who raised questions, comments, concerns about this. Thank you for joining us. Please take the quick survey. Let us know how we did. It's also a chance for you to share your email so that we can go ahead and see if you want to be connected with the Florida program. And again, I would just want to thank everyone, especially Kamaria, Alicia, Helena, and Michael for coming together and putting together this conversation. Remember, we're here together to defend, to protect, and to advocate with each and every one of us because our lives matter. So with that, I'm going to go ahead and close because we have gone way over time. But Florida, we got you. We're there with you. And thank you again so much for all the amazing advocates on the ground. We really appreciate all the work you've done. And with that, thank you all so much. Just quickly, I wanted to look at all the video of everyone, all the amazing folks that are here. We got this together, y'all. And we're going to go ahead and end. Yeah. Actually, no, I'm not going to end. I'm just going to take a minute to see us all. Kamaria, taking off the glasses is a good idea.
It's because my
So we
eyes are
can
burning
just,
because I've been holding in tears. So
yeah,
yeah,
me too. Me too.
so grateful for community.
Mm-hmm. Yeah.
And thank y'all for doing the survey.
I love y'all.
Thanks, Gina.
You.
Yeah, if people want to come off of mute and just say hello and love and anything else, please take a minute to do so. Hang on, I'm going to go
Holly,
ahead.
I want to say thank you guys for having this meeting. It was greatly needed, and at least I have a sense of idea of what to do next and how to get the ladies I work with involved. So I just want to tell everybody thank you, thank you, thank you. And I'll be sure to be involved myself with Gina and anybody else that need me.
Thank you, thank you, thank you. Y'all could excuse my
Hey,
hair.
Miss Tequila.
Hi, rushed home from work because I didn't want to miss this meeting because I know it is very vital to all of us that's in this fight.
So much for having this platform. It's very, very informative. I don't think anybody will leave here not wanting to reach out and do something because it's only going to trickle down and follow. Not just going to be Florida. Thank you so much.
Yeah. It is community. It has been what saved us from the beginning, and it's what is gonna continue to lift us up and saved us.
Absolutely.
Is all of us on this call. Yeah.
We'll be in touch.
Yeah, sounds good. We're just gonna hang out for a little bit more, and people can just go ahead and hang up when they feel like they're ready to step away, and otherwise reach out if there's anything that we can do to help.
And please, y'all that are driving, drive safe. Please, please, please.
Yeah. Absolutely.
And David, I will, if you can hear me, I will be giving you a call this evening. I'm in between things, but we've been playing phone tag, email tag, or something, but I will give you a call. And
Sounds
Tori,
good.
I'm so glad to see Tori on. Tori's been talking to folks behind the scenes too. So thank you for your advocacy.
Yeah, thank you, everyone. All right. Y'all ready to go?
Good night.
Yes.
Bye, everyone. Thank you so much.
Good night.
Good night, y'all.
Night.
Good night.
Barb, did you need me? Someone messaged me and asked me to stay.
Oh, might have been.
Whoever was host the host, like whoever's name was PWN, messaged me
Oh,
asking me to stay.
yeah, I think that's one, Michael.
I'll call him. Okay, that's cool.
Yeah. I think that might be.
Okay.
Um,
Thank you for this.
yeah, so it's just us now. It's just the two of us.
You're
Thank
still
you for
recording.
doing.
You're still recording. I didn't know if that was
That's
intentional.
helpful.